Welcome back, everybody, to the Cargo Cats podcast. I'm Carrie, Cat 1, and I'm joined here with Noelle, Cat 2, and we have an alley cat on the scene here. Laura, First Officer with ABX Air, is joining us today. So I'm excited about this podcast. I know we've got a couple of great questions, and we've got a great guest. Noelle, take the lead.
Yeah, so we're going to be covering a topic today with Dr. Alex Wolbrink. This is a topic that is important to many pilots. So hopefully we can get a lot of people's questions answered today regarding
absolutely.
medicals and things of that nature. So Dr. Wolbrink, thanks for joining us today. We're happy to have you on the podcast. We'll start, if you could describe your career and what you do exactly and what your services are.
Sure. So, thanks for having me. Looking forward to it. So, I am a physician, board certified in aerospace medicine. There actually is a specialty, in that area. And my career has been pretty much entirely on the civilian side. So, I did medical school at the University of Iowa, and then did an internship in Indianapolis, and then did the aerospace medicine residency. At the time, it was at Wright State University in Dayton, Ohio. It was closed, unfortunately, a couple of years ago, so it's no longer there. And then after Wright State, I had an opportunity to work at the FAA in their research division in Oklahoma City, and so I spent several years there. After that, I had an offer to work at American Airlines. Originally, I had an offer in September of 2011, 2001. That did not work out for obvious reasons. And so a couple of years later, circumstances had changed. And so I was able to join them. Worked there for several years, and then had an opportunity or an offer from a friend who was basically working as a consultant with some of the airline pilot unions, such as 1224. And he was asked if I would be interested in taking over his consulting business for him, since he wanted to retire. And so I started that in December of 2009, and I have been doing that ever since. And so have really enjoyed working and getting to know some of the pilots and helping them out with FAA medical related questions. And that's pretty much what I provide, or what I do is help out with anything that's related to FAA medical certification. And that can be anything from very simple questions such as can I take an antibiotic while flying, or blood pressure medications, up to much more involved things such as heart attacks, strokes, even occasionally seizures, head injuries, things like that. So full spectrum of medical conditions. And personally, I kind of enjoy that. It's kind of a you never know what you're going to get scenario situation, and to me that's kind of fun. Keeps me on my toes and helps me learn and stay up to date with a lot of different areas.
So I guess the number one question I have is what are some hot topics right now that FAA physicians are dealing with or seeing?
Probably one of the biggest hot topics is mental health. And, that's been in the news, fortunately good and bad, here for the last several years. And the FAA definitely knows there's a need, and certainly is encouraging pilots to seek help when they need that, if they feel they need that. And they have been working to try to make the process easier with their reviews. And so in the last couple of years, they have come out with some protocols that in the right circumstances, pretty simple, straightforward scenarios. It's something that actually can be handled just directly with an AME. Previously, pretty much everything had to go to the FAA for review, and that ended up being a fairly lengthy process for their review time. And so they are trying to make that easier. If things do go to the FAA, there are still, depending on, I guess, the details of what's happening, that there are still some extensive delays with some scenarios. And so it's really nice when a pilot is in a situation where it can be handled with their AME. So then we can certainly talk about that more if you want to. I suppose another big topic or hot topic would be VA disability for pilots who have been in the military and retired or left. you finish their time, and then usually either on their way out or soon after they have left, they will go through an evaluation and then may receive a disability rating as a result of that. And in the past, there have been situations where pilots have not reported that. And some of that was misunderstanding where they figured it was military and like, oh, what happens in the military doesn't need to carry over to the civilian side. And so I think they probably didn't think it was necessary. But the FAA does want to know about it. And they're not really concerned about the overall rating. They just want to know what the medical conditions are that contribute to the rating. And because there are some things that either may require additional review, such as mental health conditions, or there may be conditions that require a waiver. They call it a special issuance, but you may require a waiver from them. And so that's been kind of a big deal here for several years. I suppose something a little more straightforward are weight loss medications, and those have been big with society in general, and certainly in the pilot community. And fortunately, the FAA over the last year and a half or so have simplified that process, and so usually that's not terribly difficult for pilots to get going on weight loss medications. So that's probably some of the biggest things that came up that I've thought about. Yeah, go ahead.
So I guess the question is, do you see major changes coming for medical certification?
I really do think so. The FAA has been struggling with FAA Medical has been struggling with a backlog, pretty huge backlog for the last several years. And that was kind of an unexpected consequence of COVID and pilots taking early retirements, and then a lot of pilot wannabes applying for medicals with complicated medical situations. And so the FAA has been trying to figure out how to make a lot of those reviews easier for if the pilot applicants do the right homework. There are situations where they can bring it all in, and the AME can issue that or issue their medical. If all the documentation looks good, then that can certainly shorten either the FAA review time, or you're waiting for the FAA or waiting for them to get their medical, where again, in some situations the AME can issue that. So I know that they're trying to find ways to do that, which will again reduce their own backlog, but hopefully make it easier for the pilots as well. Something they've talked about recently is trying to make the AME guide a little bit more user-friendly. The AME guide is online, and so it's there for anybody to review, but doesn't mean that you always understand what everything means. So just because you can see the list or the requirements, you still need to know what to do with that. And so they're also looking for ways to simplify that. So they're looking for ways to, again, help themselves reduce that backlog. But by doing that, they are putting more, I think the plan is to put more responsibility onto the pilots, just to be prepared as they're working with their AMEs.
I think that it could be agreed that a lot of pilots don't know that they have, someone like you to go reach out to, that their union provides or whatnot, to talk to before they, get on Reddit or look online on what their symptoms are, or go down the rabbit hole of going to even the hospital or whatnot. And so just for pilots watching this, how important is it to utilize like a doctor like yourself that's provided through their union? What kind of benefits come from that?
The FAA is government, and so they like their paperwork. And so the more solid that you can have the paperwork when it goes to the FAA, the easier the review is going to be. Or again, if it may even be a situation where the AME can either issue it directly, or the AMEs also do have the option of calling the FAA and talking with one of their doctors and possibly requesting authorization to issue the medical. And doing your homework to have all that documentation in place just really facilitates and expedites the rest of that process. And so having again researching what you need, working with either me or the AME to have the documentation together, just makes the FAA review much easier, and easier also means faster. If there are delays, if the FAA has to request additional records or documentation, then of course that delays their review process and slows everything down. So again, I think it's extremely important to work with somebody who is familiar with that whole process. I handle confidentiality in the same way. And I actually resigned my AME designation when I started doing this consulting for exactly that reason. Technically, an AME has a higher responsibility to the FAA than they do to you as a pilot. It's not a normal doctor-patient relationship. And so, if there is something that's potentially a flight safety issue, AME is supposed to notify the FAA. Of course, not all AMEs handle that in the same way. And there certainly is some judgment and personality differences in that. But again, so by resigning my AME designation, I can reassure the pilots that if they call me up, it is a confidential discussion and that I can't disclose any information about them to anybody else without their authorization.
Right. That's a really good benefit, and I think it's something that might change the culture moving forward, and that stigma between mental health too and pilots. Just to be able to have a professional to speak with in general, to be advised on their resources. It seems like that stigma. We're seeing it. Not it hasn't been lifted yet, but it looks like that there's a lot of improvements and advocacy groups kind of blooming from that. I know there's a couple organizations that have kind of sparked some interest and growth, protect pilot mental health and give them the resources that they need. So that's really nice. That's you provide that kind of service.
Yeah, it's very important, especially nowadays. I mean, mental health is such a big issue right now within the pilot community. I know a lot of pilots who, prior to becoming a pilot, were unsure if they should become a pilot just because they were, afraid of anything that could happen. What are some of the most common reasons that pilots, when they aren't able to get their medical, when they go and renew their medical?
That's all across the board. So, and of course, the initial application is one thing, versus the renewal. And with the renewal, obviously, if you've had a major change in your medical status, I guess I look at it, if it's a once and done situation, usually that's a lot easier. If it's a chronic medical condition that requires ongoing treatment, then that's most likely going to be more involved. Your chronic medical conditions would be, things like your heart disease, diabetes, atrial fibrillation, AFib. Is a very common medical condition. Sleep apnea is something that's fairly common. And those are all going to require, certainly require documentation. In many cases, they're going to require FAA review and approval before the AME can issue a new medical. And so again, talked earlier about having the documentation and getting that submitted to the FAA for that. And then getting back to the renewal, if a pilot does have a special issuance, have a waiver, then you need to read those requirements very, very carefully. And really, there are two components to that. Now, the first component is, what do you need for documentation? And whether that's additional updated testing, reports from your doctor, labs, things like that. And so you need to go through that list very carefully. And then you also need to check to see whether or not you can provide it directly to your AME or if it has to go to the FAA first. So again, the FAA, and as much as possible, they're trying to set it up so that the records can be submitted directly to the AME for that renewal. And as long as all the documentation is in place and everything is favorable, then the AME can issue that. It usually can issue the medical for another year. There are still a few situations, mainly some cardiac conditions, some other neurological situations, that do still require FAA review and approval before the AME can issue the new medical. But again, you're trying to get away from that just to simplify the process for everybody. But again, with that renewal process, especially if you have a special issuance, you need to read that letter very, very carefully and just make sure that you're checking all the boxes, that you have all the documentation that's needed for that.
How long may someone have to wait to get their medical back after having something like heart trouble or becoming cancer-free?
It varies. It's all across the board. And the FAA has several different main teams. And so it really depends on which team is handling the case. So say, use the example of a heart attack. And heart attacks are stents, bypass surgery. Those are handled by their medical appeals team. And they're probably right now they're probably in the best shape as far as the least backlog. And so if all the documentation is there, once it's submitted, I would say 2 or 3 months, maybe for that review and the response. So overall, not too bad. If it's something that goes to the neurology team, they're still struggling. So some of those could be 6 months, maybe longer for them to review it. Some neurology cases, the cardiac cases, if a new stent or heart attack, that has to go to their cardiology panel. The neurology team also has a neurology panel, and so getting the records prepared for that panel and then just waiting for the panel to review it can also take some time. The general, they have kind of a catch-all team that they call general review, and that's things that don't clearly fit into some of the other categories. And I'm kind of currently getting mixed messages or seeing mixed information on that, because I'm getting some of those responses really very quickly, and some that are still taking many, many months, 4, 6 months, for some of those. Actually, just a couple of weeks ago, the FAA did a seminar for AMEs, and the federal air surgeon, was talking about some of the backlog and some of their efforts, and she was saying that at least at that time that the case queue for the physicians was essentially down to nothing. That's really nice to hear, but it's actually not really kind of the reality of what I'm seeing. Because again, I'm still waiting for some cases with that general review team that have been there for many months. And so it's not entirely the whole story. If things have to go to headquarters, a lot of the antidepressant, if pilots taking antidepressant, those are also still pretty slow. A year ago, they were up to a year backlog for those reviews. I think more recently they're probably closer down to 6 to 9 months or so for the review. So they're working on it. They're working hard, and they have contracted with some outside consultants to help reduce that backlog. But most things at headquarters still take quite a while. They've really prioritized HIMSS cases for pilots who have a history of alcohol or substance dependence, and so that's extremely important to them, and of course to all of us as well. So they do try to keep that backlog down, and I'd say probably closer to maybe the 3 to 6 month time frame for some of those cases. So that category is probably a little bit better. So the big question is what's the diagnosis and which direction is it headed, because that really affects what the review time is going to be.
Okay, so the medical being reinstated, it all depends on the case. Is there any way to speed up this process?
Well, that comes back to what I said earlier. Again, if you can submit a complete package the first time, then that's going to speed things up. If the more back and forth that there is, then the more time and the slower the process is going to be. So, yeah.
Right. And in that situation, it sounds like the best thing to do is for an advice for our pilot group. It's just to be organized and be informed on what's needed and provided in that packet, and maybe to consult someone like you to make sure that they've got all their ducks in the row before they submit that.
Exactly.
And
just what I was going to say. Yeah.
And you were mentioning medication earlier. That's another hot topic, at least in the pilot community. Are there some common prescription medications that pilots are sometimes unaware that are not permitted for a Class 1 medical?
Prescription medication seems to be less of an issue, because usually, that's something you think a little bit more about. And so they're more likely to give me a call to ask, is this something that's a big deal? I think probably the bigger surprise are some non-prescription medications. And sleep medications, antihistamines are one that I often get kind of a surprise reaction. For example, Benadryl is a 60 hour no fly after taking that. NyQuil is actually the same. There are some other antihistamines that are acceptable to take while flying. So those are probably some of the categories that I get the most kind of surprise reaction from. But otherwise, like diabetes medications, those can vary from 14 to 30 days. Some are a few are 90 days. For the ground trial period on that. Your blood pressure medications are currently only a 7-day ground trial, so really not too bad. And that makes sense to make sure that they're working and that you're not having any side effects from the medication. Things like your BPH, your erectile dysfunction medications are can be used on a kind of as needed basis, which is obviously what a lot of those are used for. And the no fly, it depends on what the medication is. It's usually not too bad from 8 to 24 hours. Or there are some situations where in low doses, like if you're taking for BPH, your prostatic hypertrophy, that actually can be taken on a daily basis, and you can go back to work. But it's full spectrum. One kind of big somewhat new area are so many of the immunologic medications used for cancer, other allergies, or these days, all sorts of different medical conditions. And some of those have actually become pretty straightforward with the FAA, and some still do require FAA review. But they really, especially this last fall, they really did expand the list of medications that usually are pretty easy to be cleared in that category. So that's one that's been really kind of fun to watch.
Speaking of that list, where does someone go to get that list of non-acceptable prescription medications or over-the-counter? Where do they find that?
So the FAA does have a list of medications on their website. Sometimes they're scattered, so sometimes you have to do basically just punch it into the search bar. They do in the AME guide. They do have some separate pages which list disqualifying medications. They've got two different categories. They call them do not issue and do not fly, and some that are short-term disqualifying or more long-term disqualifying. And so that's really the most reliable resource for that. There are some other organizations that do try to maintain lists of medications, and generally they do pretty well, but it's really hard to keep them current. And so I find that sometimes they're not entirely up to date with what the FAA requirements are for the medication. So I would say those are generally reliable, but it doesn't hurt to confirm that. Either give me a call just to double check, or try to find a more reliable resource on that.
Okay. And once again, back to that, like you said, I'd give you a call. And that again would be a confidential conversation.
Correct. Yep, sure is.
Okay. And then, so the other thing I was going to ask about, what was it with the medications, is that I think, and I'm sure you guys have probably heard, the story time and time again. It's important to know what's on that list of approved and non-approved medications, because a lot of times pilots go to a regular doctor. I mean, even if they're on a layover, have gone to seen a regular physician that's not an AME and get prescribed something, and the regular general practitioner just doesn't know that you're not allowed to fly, taking said medication. So that's really important to know where that's at and what you're taking, and if you can fly and take that before you consume it, even if you're given it by a medical professional. Any other questions?
If I can kind of interject with that, absolutely right. That a lot of doctors don't really appreciate how conservative that the FAA can be with some of these medications. They're things that they give out, they prescribe all the time. It's like, to them it's no big deal, but if you really step back, some of them do have side effects that they don't really think about. Right. And then the other part about that, because I'll get calls from pilots all the time, and they'll say, "Can I take this medication?" But I always have to remind them that it's both the medication and the medical condition. If you were just prescribed a decongestant for a sinus block, it's like, well, the medication might be acceptable, but you want to fly with that sinus block. So you always have to be thinking about why you're taking it, and just make sure that you're fit for duty from that perspective as well.
You may have touched on this, but as a society, we are inundated from TV, radio, social media, with all of these commercials for depression, anxiety, weight loss, etc. And I guess my question is, from your angle and from your point of view, what does that progress look like? Are they moving these drugs forward to be able to help this this population of specifically pilots? But what does that progress look like?
The FAA is patient with that, and We're kind of a side note from that. We're one of the few countries that actually allows marketing or advertising of medications. A lot of countries it's just not even legally acceptable. So yeah, you see all these ads all the time. Ask your doctor about such and such.
Yeah,
Uh,
we're inundated. I mean, as a society, we're inundated with these
oh,
commercials.
absolutely. And some what I thought was some very wise advice that I heard in medical school was you never be the first person to prescribe a medication or the last
Mm.
person to stop prescribing it. And so basically let everybody else be the guinea pigs. And that kind of applies to how the FAA looks at this. And so in most cases, the FAA wants to wait at least 1 year after FDA approval before they review a medication and determine whether or not it's acceptable. And basically, that's allowing everybody else, the rest of society, to you kind of give it a shot and just see if there are any other unexpected problems that come up from the medication that did not show up during the clinical trials. And I'll kind of say it that way that the FAA doesn't want pilots to be the guinea pig with the medication. Let's let everybody else be the guinea pig and just see if there's something unexpected so that we don't have any surprise problems while you're flying.
Right.
There are ways that they simplify that. If it's a medication that's in a very similar to something that they have previously approved, then they will sometimes shorten that review process. But certainly, if it's a brand new category, then they're going to be again very patient and just really kind of watch and see what happens with that before they do decide whether or not to allow pilots to take that while flying.
What is the process to get a drug approved by the FAA?
Internally, they have a pharmacy and therapeutics committee that reviews new medications, and they've got a again constant list that they're kind of working through, but they don't really they're constantly watching things. But my experience has been they don't actually really kind of look at a medication unless the pilot asks about it, and so if it is something brand new, then you kind of need to be the one on the point end and submit the documentation that you're taking the medication, that you're doing well with it, and then just be patient with them for with them to review it and to respond whether or not it is acceptable. So they're constantly reviewing things, but you kind of need somebody to be that your front end to kind of try to push it through the final gates.
All right. So what challenges are there for increasing the retirement age beyond 65? And have you heard how the medical requirements may change if the retirement age is increased?
Challenges are politics. That's a that's a legal decision. There's really no medical basis for an age. You can pick any age, and there's no real medical background for that. So it's not a medical decision. It's kind of blamed on medical, but that's not really where it is. So it literally does take an act of Congress to change that age. And you may remember or have seen that 2008 when it last happened, and it got tacked on kind of last minute to a bill. And it caught me off guard. I was pretty much saying, that Congress is dysfunctional, and I don't think it's going to happen. And then all of a sudden, here it is. And so, somebody kind of snuck that through. So, I think with our current political climate, I don't know. After that last experience, I've kind of stopped trying to guess.
Yeah.
But I just don't really see a lot of collaboration or planning for that. And obviously within the aviation community, there's two sides to the fence as well. Some people are pushing for it and say, hey, we need this, and others are saying, no, we don't need it. We've got plenty of pilots, and it causes problems. So I think unless there's really a consistent message from the aviation community, I just don't really see that happening anytime soon.
Mm-hmm.
Regarding whether or not there'd be a change in the medical requirements, with that last change, I discussed that with one of the FAA doctors at the time, and he said that legally they cannot have different requirements based on age. So whether you're 62, 65, 67, 70, whatever, you either qualify for that first class medical or you don't. There's no other distinction for that. There are some countries, my understanding is Japan, it does make a difference. And so once you hit 65, I think they can fly till 67, but they do require some additional testing and evaluations, in order to extend to that. But again, just legally, that's not something our CFRs allow the FAA to do, to make a distinction there.
Yeah, and at the end of the day, 65 looks different on everybody. So
Exactly. You can be
yeah.
old at 55 and you can be young at 75.
Right.
So yeah, it's just everybody's
Absolutely.
different.
Exactly.
So,
I have a grandmother who's approaching 95, and she takes the bus and subway and walks around, lives downtown Chicago by herself, and she's in better shape than some of these pilots I've flown with, but I digress.
good for her. That's awesome.
Yeah, that's amazing.
Yeah.
Yeah.
But thank you again, Dr. Wolbrink, for your time. You answered a lot of questions for us, and I think that this episode is going to be really helpful for some pilots out there who are looking for a little bit of clarity on how to navigate, their questions of their first class medical and whatnot. So thank you again for being on our podcast. We really appreciate your time.
You're very welcome. Thank you for having me. You're a great group of pilots, and I'm just glad to be part of the team, part of the family. So
Aw.
appreciate your invitation. Thank you.
Thank you.
All right. Thank you again.
Have a great day.
And remember, everybody, you can follow us on Facebook, Instagram, and YouTube. Subscribe, and remember, keep it safe.
Reliable.
And on time.